Good evening, everybody. This is an informative speech. It's on the importance of CPR and community training. Good evening, class. My name is Josh Daly. Throughout the United States, more than 1,000 people go into out of hospital cardiac arrest on a daily basis. These occurrences can happen due to a wide range of comorbidities and illnesses. People can go into cardiac arrest anywhere while doing anything. Cardiac arrest is the single most lethal medical emergency that somebody can experience. According to an article that was published by the Sudden Cardiac Arrest Foundation in 2022, survival to hospital discharge after EMS treated cardiac arrest languishes at about 10%. So with cardiac arrest being such a lethal event, regardless of age, the importance of early recognition, CPR administration, and community training remain at the forefront of trying to save lives. As a firefighter paramedic, one of the most common calls that we respond to are cardiac arrests. These can occur at home, in public, during somebody's normal life, or playing sports, or due to trauma or illness. Cardiac arrest can occur to anybody, anywhere ranging in age from newborns all the way up to people in their 90s and anywhere in between. The first part of training that we receive is CPR training. CPR, which is also cardiopulmonary resuscitation, is a means of trying to restart the heart after it has stopped. On scene of calls that we respond to, we have the opportunity to use countless different types of medications to help start and change the rhythm of the heart, everything in between. We also have access to IVs and also bone drills to drill into people's bone marrow to give medication, as well as like advanced breathing tubes, intubation tubes to help restart somebody's breathing. According to an article that was posted again by the Sudden Cardiac Arrest Foundation in 2022, OHCA, or out of hospital cardiac arrest, was witnessed by a layperson or bystander in 37.1% of cases, or by a 911 responder in 12.8% of cases. For the other 50.1% of cases, the collapse was not witnessed, meaning that nobody saw it happen. CPR was not started until EMS arrival. The New England Journal of Medicine reported that the 30-day survival rate was 10.5% when CPR was performed before EMS arrival versus 4% when CPR was not performed before EMS arrival. This shows us that early recognition of cardiac arrest and early administration of CPR can potentially save lives. The chances of survival are doubled when CPR is performed by bystanders prior to fire and EMS arrival. Recently, there's been changes that have been made in CPR training that now focus solely on hands-only CPR. In the past, you used to get trained on compressions and ventilation, which is breathing for a patient. Layperson's training has since transitioned solely to chest compressions. The studies have shown that performing only compressions without interruptions for breathing has been as effective as CPR with mouth-to-mouth breathing in the first few minutes of an out-of-hospital cardiac arrest, per a study by the American Heart Association that was done in 2019. This hands-only approach is performed by doing approximately 100 chest compressions a minute, while also contacting 911 to get emergency services started. CPR starts at the bystander level. If somebody collapses in CPR can immediately be started, survival rates are shown to increase. Although a large portion of the country is untrained, there are countless avenues to acquire the required training. In an article that was published by Harvard Health and written by Julie Corliss on August 1st of 2022, 65% of people in the United States say that they've received CPR training. Well, at some point in their life, only 18% of those people are currently up to date on their training. Many workplaces now offer CPR training and are equipped with AEDs, which are automated external defibrillators, which shock a patient's heart to try and get it back in a normal rhythm. There are countless CPR training classes scattered throughout the Bay Area that offer training in bystander CPR and AED training. This training can be completed in a few hours and will certify you to be competent at performing CPR and AED. And that certification is good for 2 years, so you have to renew it every 2 years. It has been proven that early recognition of cardiac arrest and administration of CPR can save people's lives. It is very important for the public to be trained and willing to jump into action if they are to witness such an event. It can take the fire department anywhere between 4 and 6 minutes to respond to a medical call in an urban area, and it can be much longer than that in a rural area. In that time, if CPR is not performed, your chances of increased heart and brain tissue damage increase, which lowers your chance of resuscitation even more. We can improve the communities that we live in chances of survival by early recognition of cardiac arrest, early bystander CPR, and by getting trained and certified in CPR. Thank you.